Good afternoon, everyone. We'll get the briefing started for today. On today's briefing, we'll hear from Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Associate Professor for the Medical College of Wisconsin and Director of Medical Services for the Milwaukee County Office of Emergency Management, Darren Rausch, Health Officer and Director with the Greenfield Health Department, and Dr. Aaron O'Toole, Family Medicine Physician with Ascension Medical Group, Wisconsin. Mayor Barrett, I'll kick it over to you.
Thank you very much, Catherine, and good afternoon, everyone. Earlier this week, the Wisconsin State Senate voted to end the statewide mask mandate that had been issued last year by Governor Evers. I think this has been a very unfortunate set of circumstances with the Senate taking this action. The resolution passed on Tuesday, which was sponsored by a number of Republican lawmakers, will end the requirement to wear masks in public and some indoor settings. The state assembly was expected, it is expected to take up the measure today, but there have been some wrinkles that have occurred that I'll talk about in several minutes. I think it's very, very unfortunate that the legislature is taking this action to repeal the statewide mask mandate. For almost a year, our state legislature has not acted on the coronavirus pandemic. Now that it is taking its first significant action, it's doing nothing more than picking a fight with the governor. What it is doing is not going to help anyone. In fact, it would put us among a very, very small minority of states that have no mandate. This is simply a fight with the governor. If the legislature does not think the governor has the power to take this action, then it should pass its own mandate and have him sign it. We have had thousands of people die and tens of thousands, literally hundreds of thousands of people get sick from COVID-19. This is not the time to have these political fights. What the people of this state want is they want the government to work together and put the partisanship aside on public health. Now, fortunately, the state's order does not supersede Milwaukee's order. Our plan is to have our local order in effect until, from a public health perspective, we decide it is safe to lift it. We will not allow the noise of partisan politics to affect the health of the residents of our city. The city of Milwaukee acted early to avoid any possible legal challenges to our mask order. We felt that if it was issued by our health commissioner, that there might be a legal challenge. So we took the time to go to our city council and have the members pass the mandate that I then signed into law. This way, there can be no attack on our ordinance saying that it was done by an unelected official. But without mask orders in the surrounding areas, it will make Milwaukee's order less effective overall. There is no reason in the world to have a piecemeal approach to something as fundamental as this pandemic. Businesses, doctors, the hospital systems, you name it, they all want to have a mask mandate in order. They know it's effective. And the businesses in particular understand that they cannot get back to business as usual until we get rid of this pandemic. That's why we've had restaurants, bars, and other establishments that support it, because they know if we don't deal with this pandemic head on, it's going to linger even longer, and there's going to be even greater economic damage to our community. It's not only a healthcare issue, but it's an economic development issue as well. Everyone wants to get life back to normal. So now the legislation is in the state assembly, and the reports that we just got in the last hour is that they're putting the brakes on it because they now realize that there's also a huge fiscal impact if they lift this mandate. The reports are $49 million the state could lose that can go to help people that get help for their food. The speaker has said that they're not going to bring it up today until they get this issue resolved. My request is just shelve it, just shelve it. There's no reason to do this today. There have been no public hearings on this. It's been rushed through. This is an issue where 72% of the people of this state support a mask ordinance or a mask mandate, 72%. And to have this rush through the state legislature just to start a partisan fight is exactly opposite from what the people of this state want. So I'm hoping that the assembly acts much more prudently than the Senate did, and takes its foot off the gas altogether. But again, it may not like the governor. The leaders of the Republicans in the legislature don't like Governor Evers. Everybody knows that. But don't have the people of this state have to undergo even longer periods of this pandemic because of this political fight. Please, let's let public health dictate where we go here. Let's not have partisan politics poison this debate. So now I'd like to turn to the vaccination because that is obviously on the forefront of everybody's mind. So far, the Milwaukee Health Department has completed 4,100 vaccinations in total at the Wisconsin Center. Many, many more have been provided to people in Milwaukee, the city of Milwaukee and Milwaukee County by healthcare systems and others, but that's the number that the city has distributed. 598 individuals were vaccinated on Monday and 502 individuals were vaccinated on Wednesday. People realize that Tuesday we did pause vaccinations due to the weather, but all those appointments were rescheduled for later this week. There are 507 vaccines scheduled for today, which would bring our total to 4,666. We remain committed to an equitable distribution of the vaccine. Significant efforts are underway through the Milwaukee Health Department to reach underserved communities. We know that there is a racial disparity just after several weeks in who is receiving this vaccination, and we will address this. We are working with established institutions in targeted neighborhoods to get vaccine to people who may not be connected to major health systems. A reminder for everyone that healthymke.com continues to be a useful tool for those looking to get connected to a vaccinator in our community. Finally, I want to provide an update on our COVID-19 testing numbers as of yesterday. Yesterday, we had 779 at the ballpark. We had 347 on the northwest side, 205 on the south side, and 231 in South Milwaukee, which brings our total for the week to just under 2,900, 2,897. And again, I think people recognize Tuesday, all the sites were closed due to the winter storm. The good news is, as of January 26th, and I know Dr. Weston will talk about this in depth, the city of Milwaukee is reporting a 7.7% positive rate. It is good to see our rate drop below the 10% threshold, and we want to see it drop even more. Compared with other counties in the area, Milwaukee is doing very well to mitigate the spread of the COVID-19 virus. Again, why we have our local directives in place. Our health department attributes a portion of our success to the public health orders in place and the very good cooperation people have shown in complying with the orders. So I want to give a special shout out and thanks to our residents for the commitment you have shown to ending this pandemic as soon as possible. We are headed in the right direction, but as I have stressed on past briefings, we have to keep our testing up to further prevent the spread of COVID-19. Please take advantage of our 3 community testing centers if you aren't feeling well, or if you think you might have been exposed to someone who is tested positive. And as always, wash your hands, watch your distance, and wear your mask. Thank you very much, and over to the county executive.
You're on mute, David.
There we go. Thank you. So thank you so much, Mayor Barrett, and thank you for your comments related to the mask mandate repeal. I just want to touch on that really quickly, which is, it is unfortunate to see the partisanship that is really entered into this conversation when we think about ending this pandemic. And for those who don't remember, the last time the Assembly met related to a COVID-19 package, I was still an Assembly representative. And so the fact is that if this is what they're going to do to tackle COVID-19 this year for the first time, they're better off going to not meeting. And I say that because we should not allow partisan politics to interrupt us getting over this pandemic. So with that, I also want to say that I want to reinforce something that I've been talking about the last couple of briefings, and that is encouraging perseverance when it comes down to waiting your turn for this vaccine. And so I'm excited that we are making progress in vaccinating Milwaukee County residents against COVID-19. But as the largest county in the state, this process is going to take us some time. And so I know that the waiting is hard, and I'm ready for this pandemic to be over just as much as anyone else. But together, we have to hold tight until we the time comes when we're eligible, but also when the vaccine is available. So for now, stay informed by signing up to receive alerts about the availability on healthymke.com. And you can watch for updates from your local health departments as well when it's your time to register for the vaccine. But just like the mayor said, in the meantime, continue to wear your mask, wash your hands, and watch your distance, and together we will persevere. On a similar note, today I had a pleasure and honor to participate in a press conference to pass the American Rescue Plan proposed by President Biden and Vice President Harris. And even before he was sworn in, Biden took this COVID-19 pandemic serious, and he set the tone as a leader. And I believe that their administration is going to do everything they can to prioritize effectively responding to this crisis. And so President Biden is doing the right thing by working to persevere and expand healthcare coverage, increase vaccine distribution, and really assist in ending this pandemic. And from my perspective, I'm glad to see the inclusion of over $350 billion, that's what it be, in critical support for local municipalities like Milwaukee County. And it can't be overstated how great the need is for resources to not only support Milwaukee County employees, but also to provide critical county services that many of our residents rely on. And these are services like housing assistance or grants for small businesses, but also what we've done to partner with community organizations serving underserved communities and others. And so this pandemic, this public health and economic impact of this pandemic, it continues to grow. And when we look at this unified response, like the one being proposed by President Biden, this is critical to supporting our effort to contain this virus and mitigate the consequences of an unprecedented crisis. And so without additional federal support, the severe negative impact and the public health impacts facing our local economies will be significant, and they will be compounded by severe long-lasting effects. So this federal aid, it will allow us to continue the joint response for both the public and private sector and support partnerships between local governments, businesses, and their communities to mitigate the economic, health, and public safety impacts of COVID-19. As I said before, this isn't about politics. This is about keeping people safe, giving people the help that they need, and ending this COVID-19 pandemic. And during this press conference today, we urge Congress to swiftly take up and pass the American Rescue Plan. And lastly, I know there's been a lot of talk about, the mask mandate. And so, I just really touched on that, but, we really need to follow the guidance from the CDC, and they recommend the importance of mask wearing to limit the spread of COVID-19 for anybody, so for anybody, no matter what happens, who is visiting Milwaukee County properties, please remember that, face masks include cloth face masks with 2 or more layers or breathable, washable fabric, disposable face masks, such as non-medical grade medical grade paper or procedure masks, FDA approved face masks for sign language interpreters. And so we've updated our list of items that are allowed as face masks, such as neck scarves, that are not allowed as face masks, such as like neck scarves and bandanas, neck gaiters or buffs, winter scarves, face shields, so on and so forth. But also, please make sure not to have any masks with any inappropriate images. And as always, I want to thank you for your continued flexibility during this difficult time. We all need to do our part to keep our friends, our families, our colleagues, and all of our loved ones safe. And so with that, I'd like to turn it over to Dr. Weston.
All right, thank you, Mr. County Executive. Good afternoon. First to our numbers, we have had 93,906 confirmed cases of COVID-19 in our community and 985 individuals who've died in Milwaukee County. Additionally, we now have 47,983 doses of vaccine that have been administered to county residents. We are certainly appreciative that we did receive the ability now from the state to be able to separate out partially versus fully vaccinated individuals. So we'll have that to share as well in the near future. And we're still working to get geographic information so that we can better understand the distribution of vaccine in the county. In the meantime, we do continue to see concerning trends, especially in race and ethnicity disparities in the vaccine recipients. And as we continue forward, maintaining a focus on the most vulnerable and underserved populations will be vital in the vaccination efforts, as these are also the populations that have been most affected by the pandemic. In other trends, we continue to see promising decreases in cases, in hospitalizations, as well as deaths, as we look at our percent positivity going down as well. And testing does remain low, and with what we're seeing with the more infectious variants widely circulated now in the United States, it's as important as ever to get tested if you have symptoms, close contact, or referred for testing. Now I wanted to touch on two questions that are coming up a lot lately. So one is about the 65-year and older population seeking vaccine through their healthcare providers. And the other is about the idea of double masking and which masks are best. So first, to those who are over 65 or 65 and over and are seeking vaccine through your healthcare provider. So each of our healthcare systems are reaching out to their patients as quickly as possible and scheduling tens of thousands of appointments to get this key population safely and efficiently vaccinated. Now, due to the complexity of vaccine allocation and administration, as well as the need for patient safety, these are going to be appointment-based visits rather than walk-ins. So your healthcare provider or your healthcare system will reach out to you to get you scheduled. And rather than calling them, you can sign up on healthymke.com to receive alerts on vaccine availability and how to receive it as quickly as possible. And for those who are associated with independent clinics or our federally qualified health centers, or for that matter, not associated with a healthcare home at all, you can also sign up on healthymke.com, which will notify you of the best access points for the vaccine. And it's critical to remember that in this time of national vaccine shortages, unfortunately, eligibility does not mean availability. And we hope this to change as soon as possible, and we'll be ready to respond as a community when it does. Next, there's been much discussion around the best way to mask. So first, there's some wrong ways, some bad ways to mask. The worst, of course, is simply not masking. The evidence is overwhelming at this point that masking works to prevent transmission of the virus. Really, any debate on that front ended months ago. As for mask type, we know that thin single layer coverings like neck gaiters or bandanas are simply not effective. They're not safe. We also know that masks with valves, the little inset plastic pieces, are also generally not safe as they easily allow virus particles to pass back and forth through the mask. Now, as for what mask is effective, the N95 masks are certainly the best, but they are still in short supply, and so we're reserving those generally for healthcare personnel. A close second, however, to that are the KN95 masks. So these also provide excellent protection. Surgical masks that fit well are typically the next best, and then your multi-layered cloth masks. But no matter what your mask is, if it's loose fitting or it pulls down from your nose, it's not going to be effective. As for double masking, certainly more layers are better. And if you want to put if you do double mask, put your best layer closest to your face. So for example, you may want to put your well-fitting K95 mask or surgical mask on first, and then you could cover it with a cloth mask. But in the end, the most important thing is to wear a mask. Make sure it has multiple layers and ensure that it fits well and snugly all the way around your face. Now, with the expanding distribution of vaccine, the end of the pandemic truly is in sight. And certainly with the highly contagious variants threatening a new spike in cases. But if we remain vigilant with personal protections, we can avoid that spike and continue to see downtrends, allowing the vaccine to work and speeding our return to normal. And there really is no doubt, no question that now is a critically dangerous time to consider backing down on universal masking. Thank you very much. Stay safe, and I will hand it to Director Rausch.
Thank you very much, Dr. Weston. It's my pleasure to join this afternoon to talk a little bit about the COVID-19 data from our Epidemiology Intelligence Unit. Before we get into the data, though, I want to start by addressing a few overarching themes from this week's data. For this week, the data continues to support a continued decrease in COVID-19 cases countywide compared to previous weeks. Lots of data indicators are improving, as you heard Dr. Weston mention just moments ago. Yet I want to keep reminding people that COVID-19 rates remain high and there still is a potential for transmission. The continued decrease we're seeing is also consistent amongst children as well, which is very favorable. So we have a consistent downward trend in both our adult population and our child population. I want to note, however, that while COVID disease rates are continuing to decrease, it's important to remember that we still have significant illness, deaths, and hospitalizations occurring amongst county residents. Dr. O'Toole will elaborate later about the long haulers, as they're called, but this is only really part of the problem. Quite frankly, COVID-19 has taken the lives of far too many county residents. And I do have a graphic to show here momentarily, as I'll pull it up here, looking at the two big waves of deaths that we've seen during the COVID-19 pandemic over the last 11 months. I talked last week qualitatively, but this week I have the numbers to share. When we look at the first 3 months of COVID-19, essentially March 25th through June 25th, we reported 393 deaths in Milwaukee County. When we look more recently at the most recent 3 months ending on January 15th, there were 566 deaths reported in Milwaukee County. And again, that trend looks like it's tailing off, but we need to be cognizant of the fact that deaths are a lagging indicator, and this number could continue to rise. Another way of looking at the data as it relates to deaths in Milwaukee County is now on your screen. This is a new spatial map that we've created a few weeks ago and are debuting today. This particular map looks at areas where Milwaukee County residents have passed away due to COVID. In this particular map, we've taken out group quarters and those people who live in group quarters. And what we mean by group quarters is that we're eliminating cases where multiple people died in one location, most likely due to a nursing home situation or assisted living. So this gives us a more true picture of where deaths are occurring in our community. And certainly we see the areas that are red and orange are areas where we had a lot of deaths. And we can see disproportionately the number of deaths are really adversely impacting the north and northwest side of Milwaukee City, as well as the south side of Milwaukee City. But we're also seeing other areas throughout the county where there are high numbers of deaths. So folks, remember, we're not out of the woods yet. When we still have, or while we still have COVID-19 transmission, we can have serious sequelae related to those cases, not only hospitalizations, people with long hauler type symptoms, but we can also have a lot of deaths, especially among our more vulnerable population. So scrolling back up and looking at the top at the data for this week, here we're looking at the cases over time, and this is what I'm pointing to, or what I pointed out earlier. We're seeing a sustained downward trend, and that's great to see. But again, we can't take this, we can take this as a glimmer of hope, but we can't say that we're out of the woods yet. I reflected deaths already. You can see we are going down, but certainly what we saw last week is that we've added a few deaths to our data this week, again, because that has been a lagging indicator. We followed and tracked the reproductive number for a number of weeks. Happy to report this week that our reproductive number, our transmission number, is below 1, meaning that we're suppressing disease. We certainly saw over the Christmas holidays and through the New Year holidays that we did have more disease transmission occurring. It's good to see that number suppressed, and that's probably relating directly to the low number of cases. And when we look in the city of Milwaukee, we're seeing a very similar trend as we are to the suburbs, as shown here. Testing remains readily available in Milwaukee County, and the testing data reports and reflects that we're seeing a pretty consistent number of tests being conducted in Milwaukee County over the last several weeks, around 24 or 25,000 to 30,000 a week. This week's data is pending, but certainly we expect that to increase. And we've seen some of our trends moving in generally positive directions in terms of decreasing percent positivity, decreasing positive cases, et cetera, as we've talked about previously. So that's where I want to end today with the data report. And I do want to just kind of reflect back on the vaccination campaign and try to address some common questions that we've been seeing and hearing across the county. One of the common themes that I mentioned last week, and Dr. Weston mentioned it moments ago as well, is that eligible does not equal available. And we know that despite having lots of folks eligible in Milwaukee County, we are still receiving far too few vaccines within Wisconsin and throughout the county. Just as a matter of showing you the numbers, and really and truly it's a numbers game at this point, the state of Wisconsin is receiving approximately 70,000 doses for next week. But the state of Wisconsin has received requests from vaccinator agencies like the Greenfield Health Department, like pharmacies and medical clinics throughout the area. They've received requests for 290,000 doses, and they only have 70,000 that they'll be getting. So essentially the demand for vaccine from vaccinator agencies trying to vaccinate people in our community is 4 times higher than the supply. Again, I want to emphasize that weekly vaccination planning is the name of the game, because we only find out what our vaccine is on Friday afternoons. Last week in Greenfield, we found out at 4:15 that we were going to get 300 doses. We were very excited for those 300 doses. And by the time this media briefing ends, we will have used and exhausted all of those doses for our essential healthcare personnel and many seniors in our community. But unfortunately in Greenfield, we have over 8,000 seniors over the age of 65. And so simply the supply is not there to vaccinate everyone immediately. And this story is so unfortunate and consistent with what we're seeing across other health departments and with other vaccination providers. So we continue to request your patience. As mentioned already on the media briefing today, healthymke.com remains a great resource for you to register, for you to learn more about this vaccine. This site is driven as a community and consumer education resource. We want you to be very familiar with the vaccine, very familiar with the process, so that when it is your turn, you can make an informed decision about getting your vaccine. Vaccine will ultimately be available at local health departments, but it will also be available at clinics and providers throughout the community, including pharmacies, including medical clinics. But remember, it will take some time as we build up that vaccine allotment. Take some time, familiarize yourself with your local health department website. Talk to your medical provider. Figure out how to access the waiting list or to note that you're interested, and we will be reaching out. There is no need to place yourself on multiple lists because the vaccine limitations exist everywhere. There's no need to run to Waukesha County for vaccine if you're a Milwaukee County resident, because the vaccine limitations exist everywhere. As I have said before, we will have vaccine for everyone, but it will take some time to get that vaccine as we move through our prioritization lists due to that limited vaccine availability. So I thank you all for your time, and I'll now turn the briefing over to Dr. O'Toole from the Ascension Medical Group here in Wisconsin.
Good afternoon, everybody. I appreciate the opportunity to talk with everyone and give everybody an update on this new approach that we're taking to folks that have had COVID-19 in their history. And this topic, or this term, long COVID or long haulers, has been something that is relatively new to our communications and to our lexicon about how we talk about health. And I just want to give a little bit of background here. So when we talk about long haulers, what we're really talking about is people that have had COVID and that are now continuing to suffer from symptoms that are persistent. More specifically, if people are having symptoms that are lasting more than 4 to 6 weeks, we call them post-acute COVID. And then for those that are suffering from symptoms lasting longer than 12 weeks, those kind of fit into long COVID, chronic COVID, or otherwise termed long haulers. And so what we're seeing is, unfortunately, more and more people have suffered from this virus and continue to suffer from the virus. More and more people are entering into this post-acute COVID and long COVID period where their symptoms are persistent. And so those symptoms that some people are experiencing are a long and varied list, but the most common symptom that people are experiencing are things like fatigue and a lack of stamina. Additionally, cough, shortness of breath, breathlessness or like a sense of chest tightness, headaches, and some cognitive dysfunction or cognitive fog. Now, that's not the entire list. There is a long, long list of things that people are experiencing, but that is kind of the short list of the most common things that people have. And so what we're doing about it is we've seen that the percentage of people that are experiencing this type of syndrome is more than we think, more than we expected initially. So initial reports out of Europe suggested 25 to even 50% of people initially out of Italy. And so now data out of the United States and out of the UK suggests more like 10 to maybe 20% of people that have had some kind of diagnosis of COVID. Doesn't matter if you've been hospitalized or solely as an outpatient. If you've been diagnosed, we think that about 10 to 15 or 20% of people will have some symptoms that last longer than 8 weeks. For folks that are really struggling, healthcare systems are setting up clinics such as the post-acute COVID care clinic that can help assess people and help them walk through the persistent symptoms that they may be experiencing. A lot of these clinics are offering a multidisciplinary approach where the patient is assessed and their history is kind of exhaustively gone through, because a lot of people have a long story to tell of the illness and how they've recovered or haven't. And then walking through their other past medical history and coming up with a comprehensive plan that can help people recover in a more complete way moving forward. And so that can involve images of CT scans or chest x-rays. It can involve laboratories. It can involve subspecialist referrals to kind of help give a real good picture for how people may be recovering going forward. Now, there's a lot of concern out there about what the long-term effects of COVID are on the lungs and on the heart. And those reports have been out in the media. And frankly, as medical providers, this is a new pathogen. It's a new problem that we are learning a lot about. And we're learning very quickly, but we're still learning. And so we don't really know what the long-term outcomes are for this virus. We are hoping that the real bad outcomes are kept to a minimum, but we're still learning. And so as we are learning, the stories may change and what we may or may not be doing may change. But you'll notice that as we learn more, as more time progresses, we will be able to offer more options for treatments, more options for interventions to help people get better over the course of their illness. And so I'll stop there and see if we've got any questions.
Thank you, Dr. O'Toole. Our first question is from Chuck Kornbach with WUWM, and it's for Mayor Barrett. He's asking if you can elaborate on local racial disparities in vaccine distribution and use.
Well, I haven't seen the numbers for this week, but I can tell you that based on the numbers for the first 2 weeks, 50% of Milwaukee County is white, about 26% is African-American, maybe 15% is Hispanic, Latino, and the remainder is probably going to fall into the Asian, Native American category. When I looked at the data for the first 33,000 vaccinations that were given out, there was data for approximately 25,000 of those. Now bear in mind that these were assigned by the state directive to go to healthcare providers and emergency medical personnel. So people who work for hospitals, people who work for fire departments, things like that are going to be in that first group. But what jumped out at me was that of the first 25,000 who had identified a race, 80% of those had gone to white people. And about 8%, roughly 8% had gone to African Americans, maybe 7% had gone to Latino population. So you've got 26% of the population of the county being African American, yet it was only receiving approximately 8% of the vaccinations. For the Latino population, about 15% of the county's population, and about 7%. That was, when I looked at that, that was when I started publicly saying, look, we've got to get the home health care workers in here as well, because I think there you're going to see more diversity. I think that with the first group, you have a lot of hospitals that are not located in the city of Milwaukee, and a lot of workers who probably are not as diverse as the population as a whole. And so it's skewed that way. I think now we're through a lot of that first group. And what I'm looking for is I'm looking for an equitable distribution of vaccinations throughout all of Milwaukee County, and certainly within the city of Milwaukee. I think you've got an issue right now where the vaccinators ask to have a number of vaccines. And the question that arises for me is, how many of those vaccinators are located in the central city on the north side or the south side? And you look, for example, at our federal community health centers. Are we getting them enough of these vaccines? So it's only 2 weeks. So we certainly have time to do this correctly, but I believe that we should be doing this equitably. And that's not putting one group ahead of another group. That's recognizing that we have challenges. And again, you've got older people who I think need to get it very, very desperately. I think you have healthcare workers that need to get it, but I want us to do this the right way. And it's going to take some work, but I'm hopeful and confident we'll get there.
Thank you, Mayor Barrett. Our next question is from Sharon Bajenda with CBS 58. And I see it is to Dr. Weston and Dr. O'Toole. Just for clarity, we will have Dr. O'Toole just speak to the clinic that he just referenced. So Dr. Weston, perhaps you can take this first question. It is, the South Africa variant has been detected in South Carolina with no known travel history. What is your reaction to that? And how widespread do you think these new variants are now in the country?
Yeah, so that's brand new just a few hours ago today. It certainly is concerning. Like we have talked about, each of the variants is concerning in its own way. So all the variants show higher levels of infectivity or contagiousness of the virus, which is extremely concerning for the potential of a new spike to come, as we've seen in other places such as the UK. The South African variant, as well as the Brazilian variant, both have the added problem of being better at evading the immune system, especially in people who've been infected before in the past. And so as far as how widespread they are, we don't know. Probably if we're finding it in one person, it's in more than one person, because not everybody who tests positive for COVID has their virus sequenced to figure out if it's one of these variants. So it's concerning to find one, because there probably is more than one. As far as the part of the question about the mRNA vaccines, it seems that the vaccines will be able to fight off these variants as well. Maybe not quite as effectively as the standard COVID variant that we're seeing, but luckily it's so high at about 95% that even a slight loss in effectiveness would still be extremely effective. So Pfizer and Moderna have both said that they're looking into this, and the initial data seems promising. We'll continue to follow that data and follow the science.
Thank you for tackling both of those questions. Our next question is from Rose Schmidt with CBS 58. She's asking, Mayor, is the Wisconsin Center still on track to vaccinate people 65 and plus starting on Monday? And then for anyone on the call, can you address the increased risks for this age group?
Well, I can answer the first part of that. And the answer is yes, it is. The Wisconsin Center will be open on Monday for vaccinations for people 65 and older. Please work through Milwaukee MK or the Healthy MKE website to have a reservation. So it's not a walk-up basis. It will be for individuals who have registered to get it. I also strongly encourage people who have a physician on their own to be working with their physicians. Again, the hospital systems have gotten a significant number of vaccinations as well. And so many individuals who have health insurance, I think, will be able to get them through their providers as well. But yes, to answer your question directly, it will be available on Monday for people 65 and older. But again, I don't want people to rush in there and be disappointed. Make sure you're working through either calling the health department or going to the website to make the reservation and have them contact you. Maybe Dr. Weston or Darren Walsh wants to talk about the 65 and older group.
Sure. So of course, the vast majority of diseases, COVID being chief among them, is worse as you get older, and we're more susceptible to disease as we get older. We tend to accumulate more comorbidities, high blood pressure, diabetes, other issues as we get older. And so we've seen that with COVID. We've seen that our older populations, there's a direct trend. Unfortunately, the older you get, the more likely you are to become hospitalized and to die of COVID. And we've seen that in our community. And so this is an essential population to vaccinate as quickly as we possibly can.
Thank you. The next question is from Patrick Polantonio with WISN 12, and it's from Mayor Barrett. He asks, if the statewide mask mandate is eventually overturned, what kind of impact are you preparing for as it relates to Milwaukee's reopening plans?
Well, as we all know that there are no gates or there are no walls among different communities here in southeastern Wisconsin. And so you have people who leave the city of Milwaukee, go to suburbs, people from the suburbs who go to the city of Milwaukee. And so I think it's simply going to have a sort of an aggravated effect on lessening the impact or the effectiveness of the mandate. Again, we are planning on continuing to have our ordinance in effect until we believe, based on public health guidance, that it is no longer necessary or effective. So we're going to continue to follow the science, and we're going to continue to listen to the healthcare experts rather than trying to cater to the political whims of a small group of people, we think, who are trying to make a political statement. Again, the polls are showing 72% of the people in this state favor the mask requirement. And so this is not a small group of people that favors it. So you also have all these business groups and healthcare groups that support it. So it's just very unfortunate that the state is going down this road.
Our next question is from Sarah Volpenheim with Milwaukee Journal Sentinel, and perhaps Director Roush, you can tackle this. She's asking, Wisconsin has a long way to go before all assisted living residents are vaccinated, even though the vaccine supply is already there. Can you talk about where assisted living vaccinations are in Milwaukee County specifically, and what are local health departments in the county doing to speed them up?
Sure, that's a great question, and I can answer part of it. It's important to remember that the federal government set up the Pharmacy Partnership Program. And in that program, pharmacies like Walgreens and CVS were contracted by the federal government to go out into nursing homes and also assisted living facilities and provide vaccine to residents and staff that live there. So ultimately, it's not a local health department born issue, but certainly I know in my community, some of the assisted livings have been vaccinated already and others are scheduled out over the next several weeks. But for more visibility on that, I'd really direct you back to the State Department of Health Services. They would have the most accurate information about where we're at in getting vaccine out to assisted livings and nursing homes.
Thank you, Director Roush. Our next question is a follow-up question from Patrick Polantonio with WISN 12. He's asking, other than Milwaukee, how many Milwaukee County communities have mask orders in place? With the threat of the statewide order being overturned, are discussions now taking place in other Milwaukee communities to create local mask mandates?
Well, I don't know the question of as far as how many other communities within Milwaukee County. My best guess, I would say anywhere between probably 4 and 6, but you should follow with every municipality to find that information. But the question was, I believe those conversations are happening. I think everybody is looking at what is happening at the state level right now. I'm glad that they have paused this decision, but I think every community across the state of Wisconsin is looking at public health orders or related to a mask mandate.
All righty. Our next question is from Ashley Sears with Fox 6, and it's for Director Roush. Data shows Wisconsin is lagging behind in vaccinations compared to neighboring states. Why is that the case? You mentioned that the state is not getting enough vaccines. Why do stats show only half of the vaccines being administered in Wisconsin? And where is the other half ending up?
Yeah, so let me start by just telling you what's happening in my community, in my health department here in Greenfield. And I know this is a similar story that's happening in health departments throughout the southeastern region, including throughout Milwaukee County. I have received, as of this week, approximately 600 doses over the last several weeks. As of moments ago, we've given all 600 doses out to residents, healthcare and or over 65. So I can tell you with absolute certainty that local health departments are using all of their doses on a weekly basis. And the only doses that we might be carrying into next week would be second doses. So of those 600 doses that have been given, I do have some doses for next week when people are due for their second dose, but I can't use those this week. The question you're asking, again, is going to be best directed to the Department of Health Services at the state. They are keeping the data statewide. The question you're asking is a similar question that we've been asking. Some of it is about allocation, some of it is about vaccine in transit, some of it is about vaccine that we need to hold because those are the second doses for our residents. But really and truly, the state would have the most availability and accessibility to that, and I would direct you to them.
Thank you. And the next question is from Tim Vescher with TMJ4, and it's asking for a reaction from Director Rausch and Dr. Weston. He's saying that several Milwaukee area hospitals have told them that they are vaccinating non-patient facing employees, such as fundraisers who work from home. What is your reaction to this?
Yeah, again, I'll start and I'll just tell you a little bit about the logistics of COVID-19 vaccine. When we puncture a vial, whether it's in a local health department, a pharmacy, or a medical clinic, we need to use all of the doses within that vial within 6 hours. So right now, behind me, I can hear staff rapidly scrambling to find a couple more individuals to give that vaccine to. Our focus within our health departments and the focus as I outlined by the state has been start with phase 1A, vaccinate healthcare providers, move on to seniors in your community, and then we're going to continue to move through those priority groups. I can tell you that rather than waste vials or waste doses in vials, we will from time to time grab health department employees or grab employees from City Hall to use the last 2 or 3 doses. I think the focus of the question is more wide scale, and I can't answer questions about why another entity might be vaccinating people who might not be in a priority group. And I'm not sure if Dr. Weston has anything to add either, but you do need to understand, we'd rather get a dose into an arm, even if that person is my administrative assistant, for example, than to waste that dose. Dr. Weston, anything to add?
Yeah, no, I think that's a great summary. And really, I think from talking to our health systems who are vaccinating literally tens of thousands of people, I think their focus is first and foremost on those who the state have outlined. 1A, the folks in 1A, the healthcare workers, EMS, now law enforcement, and now those over 65. So that is, I think, absolutely priority number one. There does come the time, and it's happened at our vaccine site. I'm sure it's happened at every vaccine site, frankly, throughout the country. As Director Rausch mentioned, you open that vial, and a lot of times you have to use those 10 doses, and you have to use them in a certain number of hours. And so you schedule your appointments such that you focus on those state-approved groups. But if you have an extra dose at the end of the day, you absolutely do not throw that dose away. You find somebody to get that dose in, and you do your best to make sure that it's somebody who's within the state-approved guidelines.
Thank you both. And the final question I'm seeing is from Brittany Lewis with CBS 58, and it's a follow-up question for the county executive. She says, if the statewide mask mandate is overturned, what concerns do you have about some communities in Milwaukee County having local mask ordinances in place, with others not having a local mask ordinance in place?
Well, I think when you think about the mission and vision of Milwaukee County, but as it relates to this pandemic, is we need to have one Milwaukee County just in general. And so, my fear is that not enough communities across Milwaukee County will not put in place a mask mandate, but also think that it's going to have an economic effect as well on different businesses throughout Milwaukee County. I think it's going to put some businesses at an advantage and others at a disadvantage, depending on what population they serve and where they're located. So I am concerned about this. And so we're going to continue to do our due diligence, working with all the municipalities and public health officials about what are the next steps if this was to pass.
Thank you, County Executive. At this time, those are all the questions I'm seeing. So thank you all for joining. Thank you, Dr. O'Toole, for your time today. We really appreciate it, and have a great day.